loved one is complaining about numbness in thighs after and during sitting in a wheelchair. Since we got it over a year, is this dystonia or something else? What can we do about it? So numbness to me is a problem with a nerve that is in that area that's supposed to detect sensation and then tell your brain about it. Sometimes if you are in a chair for a prolonged amount of time, the nerve can be pressed on and may not function as well. That doesn't mean that it's dead or not going to work anymore. You know, I don't know how many of us have, you know, sat down for too long or woke up with a tingling hand and you shake it out and it goes to red. So it's just a temporary thing most often. I would look to recommend that this individual talk with their primary care or their neurologist about this to see if, you know, adding cushions to the wheelchair, particular places, making sure that they have a belt in the chair, that it's not too tight. Sometimes even our body habitus can cause pressure in certain positions to nerves. And so, you know, having that frank discussion with your neurologist may shed some.
And it may be as simple as requesting a referral PT evaluation. Some PTs are just really good assessing culture kinds of issues.
I'm not sure how to pronounce this, but has ibuprofen been tried or used? It's being used to treat PTSD to remap the brain with 80% success rate. It's written as IBOQAINE. IBOQAINE.
The trial.
It just says that they've had 8% success rate being used on people with PTSD. So I don't believe that this is really a standard of care or a common thing to use for HD individuals. I'm not aware currently of any ongoing trial for ibuprofen in HD. However, you know, off-label use is a potential for a lot of different compounds. I would highly recommend that you talk with your center of excellence neurologist before starting any supplementing with other treatment strategies to help with HD. Not necessarily for this particular question, but there's a lot of almost like nonsense out there online of different things. You know, if you pay $80, we'll make a compounded supplement for you. That's a unfortunate instance of being taken advantage of. You know, if it sounds too good to be true, then it most likely is. For this particular instance, I would recommend that they talk with their neurologist to see what's going on clinical trials and type in a condition, Huntington disease, or an intervention that I would know and see if anything comes up in the area that you're at.
So I have discovered, courtesy of Google, that ibogaine is it's a psychoactive substance. I'm not familiar with trials in with that specifically in PTSD, but there are other similar things such as psilocybin that are being studied for a few psychiatric conditions. PTSD is one of them. Depression is another. Again, I'm not familiar with this specifically, but everything is, I would recommend if you're interested in that type of treatment for psychiatric reasons to be in a clinical trial. That is, there is some promise, that is, definitely the safest way to do it. And I think that the main thing that I would say about it is don't just go kind of use these things at home. If you're interested in treatment, then find a clinical trial.
thank you. I am debating on whether or not to be tested. I am over 18 and I see the current trials coming our way. Would it be smart to test now prior to something coming to market or being available to us when I believe everybody will be testing at one time?
That's a great question. So Dr. Forza will touch more about the clinical trial space for asymptomatic people, but you still want that person to be pretty sure that they're ready to receive their status. It's not something that you can unknow. So we do encourage people that if there's any little bit of uncertainty, that maybe that's a sign to wait, to think about it and think about how those results will impact you. The biggest thing too is that you don't know clinical trials are going to be beneficial to that person. It's still something that they're gonna have to live with. We don't know if they can be, if there's something exclusionary that they can't do in a trial. So I would encourage them to think about their reasons beyond just clinical trials, because we can't guarantee that's gonna be their benefit, but really how it's gonna impact their life and if this is something they want to know about themselves. So it's an incredibly hard decision. But we do recommend counseling to help you come into that decision. We recommend that you be well supported, that this is a good time in your life to receive this kind of news. And also consulting with local Huntington's clinics to kind of help you navigate that as well.
Yes, thank you, Marissa. I think definitely having a conversation with a genetic counselor, with a neurologist, with a psychiatrist will be really helpful in guiding someone whether they want to get tested. And I do agree that people should maybe consider separating the clinical trial part from the actual getting tested. Like you said, if it were to happen that there was a clinical trial for asymptomatic or pre-symptomatic people for disease modifying medication, was that something that they would want to be in? And if they were not able to participate, would they still be happy that they got tested, or at least still be able to feel comfortable and validate the decision? This potentially could change over the next few years, 5 years, 10 years, as different treatments potentially might come to market. And so this conversation is very fluid, and we'll keep that in mind as we talk with people. If there are some trials, there's at least one trial, and I'm not sure if it's still ongoing, but we'll potentially take people who don't know their status and could test them, but they wouldn't know. And we could participate in research in that manner. So there are options out there if someone's very interested in participating in research, and they would not necessarily have to know their substance.
So enroll is always a good place to start. So it's an observational study. It is open to those who know their genetic status, but also those who may be at risk and not tested. And there is no pressure to then test, but it may give you opportunity to interface with neurologists, psychologists, those sorts of things as you prepare to make this decision.
And I would just say, it's okay to know where you stand now, but also to recognize that that may not be where you stand in terms of testing in 6 months or a year. And I'm kind of the gatekeeper for those initial conversations that are Center of Excellence for testing. And I've had people, I've done this for 15 years, and I can think of one individual I think who reached out to me about twice a year for 3 or 4 years before they ultimately tested, and others come to me and are adamant and ready to test. So everybody is very, very individual, and it's okay. I sometimes say to people, it's okay to make your decision and just add the words for now to it. Right now, I'm not going to test. And you can sometimes visualize putting that decision on the shelf and say, in 1 year, I'll take it off the shelf and look at it again, and I may change my mind. So it's a process. I would also say that sometimes what I've seen over the years is people make the decision not to test, and they think it's quite a permanent decision, and they can feel this growing sense of anxiety. And for some individuals, it seems like there's a tipping point where it's more anxiety provoking for me not to know than what it would be, I think, knowing. And am I now moving to a point where I'm more prepared to test? So it's an emotional process as well that you have to keep evaluating, and it's okay if it takes some time.
And beyond just, I know people have reached out to you and, you know, decide not to and keep reaching out. If someone comes into clinic to be tested and talks with us and talks with Marissa and Dr. Rad and decides they don't want to, that is totally fine. You're not putting anybody out by saying, okay, we're gonna shelve it for now, we'll readdress this in the future. That's completely acceptable.
Thank you.